Let's talk. Mental health has always been undervalued in the world of medicine because of its subjective nature. Mental health does not appear as a discoloration or a lump, and our healthcare system was built to accommodate the population with easily measurable needs. When your medical history was in a folder at your doctor's office, it was impossible to trace the connections between mental and physical health. However, as those records were painstakingly digitized, it became possible to do a longitudinal population study on the comorbidity of diseases. I'm sure that you have heard the expression, stress is a killer. Well, after crunching the numbers, over a 16-year period, more than half the population and a third of children had a physician-diagnosed mental disorder. Yet still, mental health receives roughly 7% of total healthcare funding in Canada. In the UK, New Zealand, and Australia, that number increases only slightly to within 10 to 14%. But here is the twist. Having a mental disorder was associated with twice the level of physical disorders for children and 3 times the level of physical disorders for adults. That suggests 2 things. 1, that mental health problems can manifest themselves as physical complications. And 2, people with mental health problems will have significantly higher physical health costs. Think about that for a moment. The area of healthcare that receives only 7% of the funding, but needs to be available to potentially 53% of the population, has an astounding potential to increase the demand for resources in all other areas of healthcare. So the whole healthcare system is already overwhelmed and underfunded, but the resources available to the most influential, at-risk, and potentially costly group are negligible. What is the solution? I'm glad you asked. The institution of healthcare will have to reform from the inside, starting with the recognition of psychiatric disorders as a critical variable in overall physical health. Healthcare professionals of all kinds will need to be equipped with the knowledge and resources to recognize and refer mental health issues. However, that isn't going to happen overnight, especially from a 7% slice of the budget. So how do we improve today? We need to make the resources that are available as efficient as humanly possible. This proposal is to develop an anonymous online diagnostic interview that will help individuals and families identify mental health problems and connect with vetted linked resources so that they can begin taking steps towards recovery. Individuals, couples, and families often wait weeks or months to engage in publicly funded mental health services. One of the advantages to society of this preliminary measure includes appropriate and optimal assignment of limited resources to those who most need them. In addition to providing early diagnosis and intervention, this online interview will help to break down the stigma and uncertainty about mental health, and it will equip the patient with the knowledge and medical vocabulary that they need to make the best use of medical services. When specialized knowledge is publicly available and utilized, the systems of care therefore must raise their standards to meet a more sophisticated clientele. The U.S. Surgeon General reported in 1999 that there would never be the intellectual capital to provide service to the unmet need in the community. An undiagnosed mental illness has the potential to haunt the shadows of a person's life and lead to costly physical complications. Rather than mental health being a dark secret that they carry alone, this platform aims to empower and educate them so that they may recognize that their symptoms are understood and that help is available. The data that led to these discoveries about the comorbidity of mental and physical health is published in the Kaiser Permanente Medical Journal. The author is my father, Professor David Cawthorpe, PhD. He is the co-founder of IGME, International Graduate Medical Education, the All Children's Trust, the Can Reach Trust, recipient of the Friends of Canada Award for bringing the largest child mental health conference to Canada for the first time in half a century, and with over 40 years in the field, including complex system design and clinical measurement, Professor Cawthorpe is well positioned to organize, lead, and implement this project, which holds great potential to alleviate some measure of the burden of preventable mental disease. Standardized structured interviews have been in existence for diagnosis of mental problems for over 20 years. Published literature indicates that in the gray areas, when the situation is not black or white, computer-based diagnostic interviews are more accurate than psychiatrists. Advantages to individuals, couples, and families include access to specialized knowledge without having to navigate complex systems and without waiting for access to extremely limited resources. The ability to anonymously self-define problem areas will facilitate access to appropriate vetted resources that are demonstrated to be evidence-based. We first intend to create this platform in English, French, and Mandarin Chinese. If we surpass our goals, then the following step will be to incorporate new languages so that it can be used by more people globally. Doctors are in short supply in many places around the world, especially doctors of psychiatry. In 2014, China had approximately 23,000 psychiatrists. That's only 1.7 for every 100,000 people, a tenth that of the United States. By giving the patient access to existing and accepted methods for psychiatric assessment, our goal is to create an anonymous online interface for anyone who is concerned about their own mental health or that of a family member, colleague, or friend. Completion of the interview would provide them with a diagnostic assessment, necessary information regarding the condition, improved health literacy, and links to vetted resources for recovery that are best suited to their individual needs. The initial stage of the project requires funding to develop the website and mobile interface to host the interview, a user-friendly version of the psychiatric assessment tools that are currently used for an initial diagnosis by specialists, a comprehensive database of the tools and resources employed by psychiatrists and healthcare professionals worldwide for treating mental illness, and a dynamic media outreach campaign to raise awareness about mental health and this new tool for improving access to care. Our society and our healthcare system are both a long way away from recognizing the importance of mental health. However, this tool has the potential to alleviate some of the burden on the healthcare system to make way for much needed adaptation. Mental illness will affect us all at some point in life. Whether it creeps up on ourselves or our loved ones, we can only hope that the environment for discussion is positive and accepting, and that we can locate and access the resources to deal with it. Your time and generosity are immensely appreciated. Thanks for watching.